Hi there, my name is Keisha Perry and I'm here as a student of the Northwest Florida State College, and I'm going to talk to you today a little bit about the Hospice and Palliative Nurses Association. So this is a group of nurses and advanced registered nurse practitioners who work in the field of hospice and palliative care. We care for some of the population's most vulnerable patients. These patients are terminally ill, or maybe they just have a serious illness or injury that they are seeking no aggressive treatment or care for. Maybe they're receiving end-of-life care, or maybe they're just seeking more of a comfort care while they still get a few treatments here and there, but they're not seeking true curative treatment. And these patients are vulnerable, they're sick, they're dying, and they really need advanced comfort care. They need people that are devoted to providing that specialized care to them. And the people that are a part of this organization, that is our goal and our journey in life. That's what we go to work for every day, is to help those patients. So we'll talk a little bit about the organization. I've just got a short presentation for you. So the mission of the HPNA is to advance expert care in patients with serious illnesses. And the vision of the HPNA is to transform care and cultural awareness for this population set. So the main goal is just that any goal as any nurse's goal is to advocate for our patients and to provide the best care that we possibly can for these patients. So we want to do whatever we can to further that care and further the ability to provide that care. So the pillars of excellence for this organization are education, competence, advocacy, leadership, and research. All of these are the main goals of the HPNA. So education is, of course, important. We should always continue our education, further our education. You can never stop learning, especially in nursing, because there's always something new just over the horizon that you're going to have to learn and be able to be competent in. Competence is the next one. So all of our patients deserve to have practitioners who are competent and confident in their craft to provide the care that the patient needs. It's important that we are advocating for our patients and advocating for these nurses that are providing this care. It's not a very glamorous job sometimes, but there has to be people that are willing to devote their lives to that, and that's what we do every day. Leadership is, of course, important. Nurse leadership is very fundamental to what we do every day. There has to be a leader to guide the ship and to guide us into the right direction, and so that we know that we're doing what we need to do for our patients. And nursing research is, of course, fundamental. We have to base our practice in research and research-based things that show that this is going to work and this is what we need to be doing for our patients. Research is always something that has to be funded and has to be a priority. So why would you want to become a member of the HPNA? Well, as a member, you get access to a bi-monthly journal. So they send out 6 a year. You can get a paper copy sent to your home, or you can get one, you can see it online, get the online version and have access to it anytime. As well as you get to network with others that are in your profession. So this is a group of people that are all doing the same things that you are doing every day. You can bounce ideas off of them and get feedback from them and talk about what's working, what isn't working. Because while we all work in different areas, different organizations, different groups, so many things are the same. You can get professional development from the group. There's always opportunities that are listed in the magazines for furthering education and what you need to do, what's going on in the world of hospice today. Support political action. There's actually people that work with the HPNA as partners in care, and they are lobbying on Capitol Hill for things that are furthering the hospice mission. They're working on getting more funding for us, or it's one of the big issues in hospice right now, especially, is that it's kind of overcrowded with organizations that are providing hospice. So they're working on getting those bill of needs. You get to reduce the certification costs. So if you are a CHPN, Certified Hospice and Palliative Nurse, which I have that certification, the study materials and the actual certification exam cost is pretty steep. So anytime you can reduce that cost, that's wonderful. So that's a good benefit for it. You get access to continuing education materials. So you have to have those CEUs to renew your nursing license. And as a benefit of this organization is that you get access to their materials so that you don't have to pay for them. They're free materials that you can use for CEUs, as well as you have the knowledge of knowing that these materials are going to be things that you're interested in reading, interested in doing, because it is based in hospice. So that's good. You get access to conventions, teleconferences, educational presentations. There's just a wealth of knowledge that is on the website. As part of your membership, you have access to it. The cost of the membership, it's expensive, but it is what it is. For an RN, 1 year membership is $99. If you want to get the 2-year membership, it's $180. And if you are a registered nurse student, so you're a full-time student and you already are licensed as an RN, then 1 year membership is only $55. So that's a big discount. That's great. And you get full access to everything. The organization itself is, it's a very good organization to be a part of. I've enjoyed my time of being a part of the organization, and I'll continue to be a supporter of it. I really enjoy the materials that I get from it, and just the community type feel you get from being part of a group of people that really know what you're going through day in and day out, and all the information that you gain from it. So thank you for listening to my presentation, and have a great day.